We are going now to another kind of movement that we have in orthodontic. This type of movement is very common because sometimes we just apply force, the force for a kind of retraction or protraction that we want to happen, distalization of just one tooth, and we apply the force and we don't think much about what's going to happen. But the outcome of this kind of movement is going to be almost always the same, an uncontrolled movement, because we are applying the force far from the center of resistance and we are not having a control of what we are having here. In this situation, when we apply the force away from the center of resistance, not at the height of the center of resistance, we will have, as a result of the movement, a tipping of this movement, a tipping of this body, in this case, my tooth. So this is what's going to happen. As you can see, we have an uncontrolled tipping here. We didn't control anything, we just put the force and expect that the tooth goes forward with the crown. But as you can see, we have a crown going palatally, but the root is going buccally. What can I do to control that? We're going to see that in another session of our course. But for now, we have to understand that just one force passing outside, not at the level, not close to the center of resistance, we will have the same outcome, non-controlled type of movement. This is uncontrolled tipping, as we call it in orthodontics. So if I want to understand what happened, I need to understand those other concepts that we are going to address from now on. The center of rotation we're going to see later, but this one, the moment. What is a moment in orthodontics? We call a lot of a moment. It was generated during the movement. I don't need to control the moment. I have a different moment that allowed me to have a specific center of rotation. So all those things, I think you've heard about it before. And sometimes you say, what is going on? Why you have to say moments in orthodontics, center of rotation? Wow, this is important for us. Regardless the type of orthodontic appliance you're using, you need to understand that. You need to control, or even try, or at least try to control that. At least try to understand and manipulate forces in order to have the best outcome, the best kind of orthodontic movement that you are trying to have. So we need to understand that. A moment is nothing but just one kind of tendency in our body. We are applying force outside, we are applying force far from the center of resistance, will tend to move that body, not a translation of that body, but some kind of tendency of rotating it, some kind of tendency of inclining it. So in this case, this tendency of inclining, let's say this root, this body here, is called a moment in orthodontics. So moment is tendency to tilting or rotating when a force is applied away from the center of resistance. And the magnitude of the moment is calculated when we know the force and the distance, the perpendicular distance between the line of action of the force and the center of resistance. Why perpendicular? Because it's the closest distance between the line of action of the force and this point that we are measuring, which is the center of resistance. So in this situation here, we can just understand what is the tendency of the moment, knowing the force, the magnitude of the force in grams we have here, and the distance between the line of action of the force and the center of resistance. If we are applying, for example, 150 grams of a retraction force in this situation, 10 millimeters away from the center of resistance, our tendency magnitude, our moment, our rotation or tilting magnitude here, the moment is 1,500 grams of moment. And the representation of the moment is this curved arrow that you see here. The way to see the direction of the moment is bending this vector around the center of resistance. So we have the sense of the force that way. If we just bend this arrow around the center of resistance, we see which is the moment direction. We call it this clockwise direction of the force, meaning we are going this way. We are going this way. And so this is a clockwise moment of 1,500 grams when we apply the force 10 millimeters away from the center of resistance and 150 grams of force. So this is the way we calculate this. Why is this 10 millimeters? Because I showed you before that is the distance between the line of action of the force when applied at the center of the crown and the center of resistance. Of course, considering a periodontal healthy teeth, periodonally healthy tooth. So in this case, 10 millimeters is the average of the distance between the center of the crown and the center of resistance. Okay? We are applying the force away from the center of resistance. So we need to understand what is the type of movement we are imposing to that teeth, anterior teeth, or just one tooth. In this case, we have this huge tendency of tilting these teeth. Okay? So this is the outcome that we are seeing. And then we need to understand that in all other views, we can apply the same concept. If we are having this force away from the center of resistance, the moment will be generated, and in an intrusion fashion, in an intrusion type of movement, the same thing will happen. We'll have the intrusive force that will tend to go with the center of rotation up. This is the same thing if we apply this force, as we are going to see, at the center of resistance. The center of resistance will move up, but now we are applying away from it. The center of resistance is still moving up, but we now have another tendency. We're not applying more energy to the process, to the system. We're just having an outcome of the force I'm applying outside the center of resistance. So the moment is nothing external of the movement. It's a tendency of, in this movement, change the way this body is going to move. Not more translation, but with an inclination. So if I'm applying the force away from the center of resistance in an intrusive movement, we will have also the tendency of inclining that crown and having this uncontrolled tipping in this view. Not just retraction, but intrusion also, and all movements we impose to a tooth are going to respect the same kind of concept, okay? So we have it here. Let me ask you something. Am I in this intrusive moment saying, intrusive force saying that all the time, every time you're applying an intrusive force to anterior teeth, we will have a moment. Think about it. Just 1 second. I'll let you think about it. Pause here, and think. Is there a way to apply the force, an intrusive force, in this anterior teeth and don't have a moment? Yes, there is. For example, this way. If I have a very retroclined teeth, anterior teeth, and I'm applying the force this way, what matters, always take it into consideration, is the relationship between the line of action of the force and the center of resistance. It's not because you're applying the force in a buccal way, in a bracket, in a bracket bonded buccally, that you will have a moment generator intrusion. Of course, most of the time we are going to have this intrusive and this tilting of anterior teeth because we have this distance. When teeth are well positioned, meaning are well inclined or close to it, the center of rotation is far from the position you are applying the force. But there are some situations in which the center of resistance is not is at the same level of the line of action of the force, and then in this situation we won't have tilting. We'll have a real intrusion without tilting. Okay, that's not common, just something for us to think about. Okay, and of course, thinking of it, we see that the more far the force is from the center of resistance, the line of action is, the more we'll have the moment, the more we'll have the magnitude of the moment. The higher will be the magnitude of the moment, okay? So this is something to consider always. So I think we are going well here, thinking very, very precisely about this relationship. And we are going to learn how to manipulate this relationship between line of action of the force and a little bit more farther from this. We'll see how to manage moments and counter moments to achieve the best relationship and the best and the intended center of rotation of the movement. Okay? So for now we are good. See you soon. Bye bye.